Hello everybody and welcome to day 14. I had to think.
We did, we're there.
Yeah, 14.
Yes.
Just me again, I think, in this video.
It is. I could have gone off had a cup of tea by now.
I know, a super difficult one yesterday and I got another super difficult one here now.
I don't think I've got anything left. Oh, a little bit.
So essentially what's happened here, this lovely lady's come to see myself following a course of antibiotics.
Ooh,
the patient does a lot of swimming and diving is kind of the hobbies. So patient unfortunately has picked up a slight infection along the way. Has had previous infections.
Yeah.
You can see the ear canal is not really full, but the patient had a sensation of fullness. And what we've essentially got is a very, very thick, dry layer that of essentially discharge, like really, really dry discharge. You can just all that kind of yellow. You can see it there.
So is that going all the way over that thin layer's going over the eardrum as well?
Yeah.
Eardrum peel.
I know. It's that time again.
Better make this a good one, take a degree.
I hope so. I hope so. No, I remember that lady was feeling absolutely, great after this was cleared. Again, it's that kind of. It's hard to explain, but if this was seen through a normal otoscope where the light's not quite as strong and the magnification's not quite as good, someone might look at this and say, "Oh, well, the ear's clear. I can see your eardrum. It looks okay." But there it comes.
Here we go.
So with the antibiotic, it's not an oral antibiotic that the patient's been taking, but it's a spray, essentially an antibiotic spray that the patient has used inside the ear. A lot of them tend to be acetic acid, which this is basically what it does. You'll normally have really wet discharge, and then you use the spray, and this is basically what it does. Is it fights off the infection and then just kind of dries everything up, and it almost kind of goes like a shell. Is the only way I can kind of. It's really difficult to explain, but I've popped a little bit of olive oil in here just to help us peel this a little bit easier, because without it we're not really going to get this out.
I tell you a good analogy for it is, in America they call it Elmer's glue. The school glue.
Oh yeah.
If you've got that on your hands, you peel it.
Yeah.
It's that kind of consistency.
Just trying to get it. It's just like, because it's folded around, I'm not getting that angle. I almost need to kind of pull that back up a bit so I can get that grip. Not really going to get much. Not going to get anywhere here, I don't think.
No, I don't think. Well, I don't know. You've lifted the bottom up, but I think it's going to shear more than.
I could probably turn a little bit now on it.
It helps though, because you've taken some of the length off it, so it means you can peel a bit more across now, doesn't it?
And we've actually got a little ledge now that we can grip onto. I'm trying to avoid the oil
I know.
just to stop it from blocking up my view.
A good grip. Oh, see this? You can't beat that. There's just something really satisfying about seeing it all just peeling away, and that lovely fresh skin underneath then.
Yeah. So I've popped the oil in, but I haven't gone in with a suction, just because I want to try and leave as much of this oil in to slip underneath basically this dried up infection.
Yeah, I think you probably, I was going to say you're probably going to hoover the excess out now.
Yeah. Probably running on the side of my face by this point. Right, am I going to get any more peel?
I think you might, I think he's going to peel down to, because the oil now has gone underneath. Oh, see? Nice. Look how the top's going there.
Yeah. Oh, lift the bottom now. I'm going to lift that. I want it to be like a, what's the word? Husk? Not husk. Husk? Yeah, I want it to be like a husk. I wanted the whole thing to like come out like a thimble.
Yeah, that would be cool. Yeah, that's peeling across the. See, I now look. I be forceps.
Yeah. Right
down to left, like that diagonal line, and watch it all just peel down the eardrum.
I think I'm trying to just hold this to build up the pressure to get a bit more of a peel.
So I don't think he's quite onto the drum yet, is he?
No, not quite.
It's whether you've got to work that the bit you were just looking at there, that top layer, right, and to peel that down a bit.
Tricky.
Yeah, not an easy one. These are my favourite ones to do, I gotta be honest.
They are, or you're not?
Oh, I love them.
Oh yeah.
I love it.
When they come out like this, I love them when they peel like this,
Yeah.
and you know when they just break away in tiny little pieces. That's the ones I hate doing.
Or I tell you the one I love is mastoid cavities with the skin, this line in the cat, and you pull it, and then you can just see like it all coming away.
Ooh, just use the edge of the forceps, you know. Oh, problem we got is just kind of re-sticking itself back to the ear. Oh, there we go. That's in the jaws there now. And
that's a nice grip.
Yeah, gentle.
I'm disappointed you take it. I want a really good peel. Get out.
Yeah. Rhys.
It's that top right. It's just above where the suction tube is. He's holding on, isn't he? Oh, come on. See, these is why they're so satisfying.
You'll see the colour difference of the eardrum once this comes away. It's, you know, when you see these like yellow patches, I mean they again with a view that's not quite as good as the endoscope, it might look like a bit of like middle ear effusion or glue ear, but especially if there has been an infection, it's quite likely to be this like shell of a dried up infection, dried up discharge.
It's almost like what do they call it, a plaque, isn't it? They call it a plaque. So it becomes it's just like where the infection was, almost it forms like a biofilm on the canal wall, and then when you kill the infection, you're just left with this kind of hardened plaque.
Oh, I was trying to drop this down from the top here.
I can see.
Again, it's pretty tough, this bit. The oil wouldn't really have touched this bit.
No.
It's absolutely solid.
Because you were eyeing that little curl, almost like the break of a wave that was just on the top portion. You were eyeing that up a second ago.
Yeah, you got it. Again, it's difficult because you can't really go kind of poking and prodding. I mean, up to a certain point you can, but you got to be extra careful in this sort of area.
I can see what you're trying to do. You're just trying to see if you peel this top section, whether it's going to run all the way down to the top of the eardrum.
You've got it. So I'm trying to do anyway. Oh, still kind of attached.
Yeah. Should get the patient to stand on the head and the oil will get to the top bit.
Just going to strap you in and just turn it upside down. What do you like at doing handstands? Oh, it's so dry you just can't get a grip with the suction. I mean, there we go. It is. Jinx myself now. When it's this dry and there's nothing to really grip onto, just using the suction is actually quite difficult because, like I said, it doesn't hold on to anything. But that is starting to go.
Here we go, Tate.
It's starting to go. Right, forceps on there now.
Yeah,
it's got to be.
It's got to be forceps on that. Ooh, go on.
Pull it down now. Pull it down gently. Right, okay. We could kind of see that wasn't attached to the eardrum anyway. I just wanted to see if it, I wanted to see if it did bring away any of the other sort of side pieces that were slightly attached to this little tiny.
I'd love to have that perfect cast to the eardrum. Bunch it.
Yeah.
Onto the side of him now.
Right, I'm like going, come on, let's get this away.
Yeah.
Go, just underneath,
Yeah. No. That's the grip. That's the area. That's the grip.
That's the one there.
Oh, Taylor, look at that peel across there. Look at that.
I remember the patient saying, as I was pulling that away, she was like, oh, it's like, it's like popping and bubbling. That's just where the oil has got underneath it. We've still got quite a big piece left. But now most of that is come away. That should come away a lot easier now.
Look at that, all peeled down that one side.
Lovely.
Look at the size of it though. Wow. Yeah, all right, I'll give you that. That was a satisfying one.
Yeah. You can see it's still a little bit inflamed. There's a little bit to the left-hand side there now. Probably going to have to use a fine end on this bit.
Yeah.
Yeah.
But sometimes if you square onto them.
Yeah, that when sometimes, yeah. But you can kind of see the difference of the eardrum already. It's a lot more kind of, it's a bit inflamed. Look at that coming away.
See, how can no one find that satisfying? How can anyone not find that satisfying?
It was actually quite a nice one to do. It took me a while, but you can see there's a little bit of scarring there. Those little white patches going on the side. There's a bit of scarring.
Fair play.
Might still be a little bit of gluey, there. There's a bit of a retraction there. Bit of inflammation, but the patient actually was hearing so much better after we removed that that dried up infection from the
Fair
front.
play, man. That was a good one. I like that one. I like that one a lot. I like that one a lot. Well, guys, thank you very much for watching that video again today. I hope you're enjoying Waxvent. We are 16, we're not even 2/3 of the way through. We're over halfway now. So we've got 10 days left to go on Waxvent. If you are enjoying it, don't forget you can always like, heart, share, follow and subscribe. If you're thoroughly enjoying it, you can also consider becoming members of the channel. That way then you get to see even more videos every single week. But until tomorrow, take care of yourselves.
Take care of your ears.
And take care of one another. And myself, lovely Miss T Green. We'll see you for day 15. Bye, everybody.
Bye-bye.